So, good afternoon, good evening, good morning, and welcome to my People and Pet Therapy podcast bonus series, where we're going to be shaking up the vet industry in a good way, So, when Puss needed to access some services, she'd had some acupuncture, and she had some back issues, and I started to think about, well, actually, when I have back issues, who do I go and see? And you go to see an osteopath, don't you, or a chiropractor? And I started to think, well, is it possible for animals as well? Do they exist? So I Googled, and yes, absolutely, they do exist. And actually, yes, she has seen a chiropractor. And so the whole intention for me for this series is, as pet owners, is empowering you with knowledge of different services that are available that can work alongside traditional veterinary medicine. So in continuing with this series, today I have the absolute pleasure of interviewing Sophie Allain from A S Animal Osteopathy. So welcome, Sophie. Thank you for joining me for this interview today.
Well, thank you for having me.
You're very welcome. So for our listeners to start with, would you like to tell me just a little bit about yourself and what you do as an animal osteopath?
So as you say, I'm Sophie Allain. I'm French, if anyone can hear it. I came to UK to study animal osteopathy, and I've been here for about 15 years. So I work with dogs and horses mainly, and I'm based in Brighton. Do you want me to tell you a bit more about osteopathy?
That would be lovely. Thank you. Yes, because I'm sure our listeners are like, can you tell us, what you do? What is an animal osteopath?
Yeah, so osteopathy is a holistic medicine. So that means that I work on the whole body, muscle, joints, organ, anything. And my aim is to palpate the body, find any muscle tension, any joint restriction, basically anything in the body that doesn't move. Um, the body has a mechanism which is called homeostasis, which is basically the capacity of healing itself. And when something is not moving, you don't have blood flow, you don't have nerve supply, that capacity to heal itself is really reduced. So basically, the osteopath is getting everything to move to get optimum health and basically allowing the body to heal itself.
Lovely. And that makes a lot of sense. Very similar to ourselves in a way, isn't it? That again, we have the possibility of homeostasis. But in order for that to happen, everything's got to be in alignment, everything's got to be working well. If we haven't got good circulation, obviously the blood, the blood's not going to be able to get through, and so on. So that does make absolute sense. And I know certainly from, as I say, seeing an osteopath myself, that, as you say, they've worked with my nervous system, with my joints, with my muscles, and so on. So thank you for explaining that a little bit more for us. So what I would ask you is, just really in line with that, what conditions do you tend to see, or what conditions can you treat? They're kind of slightly different, aren't they?
Yeah, they are a bit different. So what can I treat? Because osteopathy is so general, we work on everything in the body. I can actually help with so many different pathologies. So I can help with arthritis, with sprained ligaments, with digestive system issues. We know the link in between the mind and the body. So before I've helped with behavioral issue because they were coming from pain. If you look at horses, it can be something as simple as, oh, my horse doesn't turn his head left as well as it turns his head right. So it can be very subtle things for ridden horses. So yeah, and anything basically I wouldn't say anything because there is pathologies like cancer. Well, I won't be able to obviously heal the animal, but I think I can help with a lot of different things. What do I work with the most? I would say it's arthritis in dog, um, because the way the body works, the body doesn't go from being healthy to being unwell straight away. You start having tension, the body doesn't function as well as it should, and all of that kind of builds up through time. And because of all of that, you then get arthritis later on. And that's when your dog is going to start being lame, and it's going to be kind of obvious that something is wrong. So that's when the owner realizes that their dog is not doing so well, and then they call an osteopath. But I think I would love to be called way earlier on, even if it's just for a checkup, to make sure that you don't have those tension that can then become arthritis later on.
Okay, lovely. Thank you for that. And I know at some point we will double back to what you were saying about pain and behaviour, because I think that's quite a big association, isn't it? And with regards to what you've just shared there about wanting to see them a lot sooner, how as a pet owner might somebody decide that rather than seeing their vet and perhaps having the NSAIDs, the non-steroidal anti-inflammatories like Metacam and Meloxicam and things like that, where would they go from kind of going, I'm going to continue going to the vet and we're going to manage it with some kind of medication, versus, oh, actually, I'm going to see Sophie, I'm going to see an animal osteopath. So where would, as a pet owner, we kind of make that distinction where we might want to follow this osteopathy route?
This is an answer I can't really, a question I can't actually really answer, because I think it's a discussion the owner needs to have with their vet, because I'm not allowed at all to give any advice on medication. So I wouldn't tell an owner, no, you should start with the anti-inflammatory. So I think it's down to the owner to wait the option, and to maybe go to their vet and be like, I don't really like my dog to be on anti-inflammatory. I know there is osteopathy and I would like to give it a go. What do you think about it? So I think maybe it's about chatting with the vet about what we can do and what's good to try, and maybe spread the word about the effects of osteopathy. So I think my role would be more to educate people and vets, and then it's down to the owner and the vet to make the choice.
Yeah, and I agree. I mean, this, you know, we said this earlier on, you know, this is about empowering pet owners to see the choices that they might have available, the same, exactly the same as if we go to see our GP. There's going to be a point where we actually might go, actually, could I see a specialist? Can I see a consultant who works specifically with, isn't it? So, but we don't, you know, we're not dissing a GP. We're just saying, actually, you know, this is what I would like to do. I'd like to actually explore my options. And so this is our suggestion, really, is, you know, you're still maintaining that relationship with your vet. And actually, I think it's courtesy, it's respect, you know, to actually ask for that discussion with them and just say, because again, you know, it might be that they have particular vets that they know who are osteopaths, or they might know of an animal osteopath who they may recommend, you know. So absolutely, it's about keeping that relationship with your vet, isn't it? And just saying, actually, I really feel like I you know, I want to just see if we can try something different to the medication, and see where this takes us. And absolutely, you know, even when I work with animals, absolutely, I am not in a position, and I never would tell somebody to stop their medication or change it in any way. As you say, that is purely for a vet, and between a vet and the client. So thank you again for, you know, sharing that and clarifying that as well. So you know, again, leading from that, so if somebody said, actually, I would like to invite that conversation with my vet, if they wanted to have a referral to an animal osteopath, I mean, obviously they'll need to chat to their vet in the first place, of course, but would the referral need to come from their vet? Can they contact you directly?
So the way it usually work, people contact me and I send the form to the vet. So it's called the consent form, where I basically tell the vet, is it okay for me to work with that patient of yours? So I give the reason. So I send an email to the vet with the form. The vet just need to sign it, send it back to me, and then I can work with the patient. If the vet wants to call me to discuss the animal, I'm always happy to have a call so we can have a chat and see what's possible.
Okay, lovely. And when you have, you know, finished your treatment with that particular pet or animal, do you then send a clinical report to their vet so they've got that on record, or how does that work?
So it depends which animal and why I'm seeing them for. If I'm seeing them for a checkup, I'm not gonna do it. because if I find a little bit of tension on one of the back muscle, the vet is it's probably not relevant for them to know that. But if we are speaking about big pathologies, then I will go back to the vet and say, this is what I found. Sometimes I can wait a few different sessions before emailing the vet. And I can tell them in the last month that happened. So it depends. I think it's case by case.
Yeah, I was just going to say that it is very much going to depend on what the condition is, what treatment how many treatment sessions you're having, and so on and so on. So yeah, absolutely. So it's very contextual in that sense. Okay, thank you for sharing that. And in terms of like a consultation with yourself and a session, I appreciate that. Again, it's going to be very contextual and depends on the condition. But for a pet owner that is very new to animal osteopathy, what would a kind of very general consultation look like? So if we take your example earlier for, a dog with arthritis, for instance, what might the consultation look like for them?
So I usually get into the house or to the stables. I always start, especially the first session, to have a big chat with the owner because I want to know the whole history of the animal. And this gives me a bit of time to say hello to the animal, for the animal to get used to me. If it's dogs, I usually start watching them walking and just saying hello to the horse. I can also spot the environment. So what kind of flooring is in the house? Is there other pets? Is there a lot of stairs? Kind of a lot of little information. So it's all about taking in everything around me at that time. Then I watch the horse or dog walking. So I may ask the owner, can you get the horse to trot? Can you get the horse to turn around that way? Can you get your dog to sit? Once again, that's going to be different depending on the animal. After that, and sometimes I do it depends, dogs and horses. Usually dog, I run my hand over them before getting them to walk. And dogs, I will do that afterwards, just because it's easier. So I run my hand over the body to feel any tension, any lump, any bump, any heat, anything that feels a bit different. I then usually would test some joints to see if there is any restriction of movement. Once I've done all of those, I've got a good idea of what's going on in the body, what kind of dysfunction I've got, and then I will start the treatment. So for the treatment, I've got tons of different techniques, can be myofascial, joint mobilization, craniosacral. So I use all of my techniques. Each treatment, even on the same animal, is going to be different. And once I finish with the treatment, I will discuss with the owner. So I'm going to tell them what's going on in the body, what I've done, and I might give them advice on what to do in the next few days, how is their animal is going to be in the next few days, and maybe for dogs, advice on weight. If a dog quite often need to lose some weight, so I'm going to advise on that. If I want a horse to do some type of work, different exercising because I want more muscle somewhere, I'm going to discuss that. And usually I would rebook another session. It can be in a month, it can be in 6 months, but I usually like to do it straight away at the end of the session. So we have a plan, we know where we're going.
Lovely, thank you for that. Because I appreciate that must be hard to share when it's like different cases are going to require different things. And just going back to what you said, I'm gonna pick up a few things. So I completely relate with regards to what you're saying about the beginning of the consultation. I know myself when I go to visit, to visit pets in their home, I do exactly the same thing. I'm looking at the environment, I'm looking at the flooring, I'm looking at, how they are with an owner. I'm looking at what things could relate to the situation that could be relevant to the situation. So yeah, it's very very similar, and definitely I will just sort of, I call it like meet and greet, in a way, is I'll sit with them a bit, because there's nothing worse, I think, than, you know, if you're going straight in, you know, I mean, can you imagine if somebody did that to us, you know, that we went to the osteopath and they just laid us on the you know, their table and was just like, right, I'm going straight in, and you'd be like, whoa, you know, you haven't asked me any questions or anything yet. You know, and especially with pets, you know, it's, again, it's trust, but even with us, isn't it? It's trust. It's them feeling into your energy, because, you know, they're sentient beings. We know that they pick up on how we're feeling. You know, they're going to feel into your energy and like, okay, this person seems really nice, and, you know, so they'll feel into you, won't they? And they start to get to know you, and they're going to use their senses, you know, especially sniffing and smelling, aren't they, to really get a good picture of you, if you like, on that. So that does make a lot of sense. And you mentioned there, you know, that you might use the different techniques. And I wondered, you know, again, this could be me just being quite naive on what's involved, so apologies if it is, but could you explain what you would mean by myofascial technique and by craniosacral, and the other one as well? I didn't quite manage to write that one down, but just to explain just briefly what each of those are.
Yeah, I think that might be a bit complicated because really they're techniques, so a lot of technical term and a lot of things happen. I think myofascial I would use if there is some tension in the muscle and the fascia. It might be applying pressure, it might be stretching the tissue, it might be just having a really soft hand on the area. It might be pumping as well on the tissue. So it's a lot of different hand movements that's going to happen on the muscle and the fascia.
Okay.
Craniosacral, it's to be applied on the nervous system. So basically, you've got obviously your skull with your brain and your spinal cord, and there is a kind of a movement happening through the day with the cerebrospinal fluid. So usually craniosacral, you kind of work of this fluid movement. That's really tricky to explain and really tricky to feel. It took me about 4 years to start feeling that movement when I was studying. So it's about rebalancing that movement. And this fluid is feeding the brain and spinal cord and protecting brain and spinal cord as well. So it is a very important fluid. And when you're working on that, you can literally have effects on the whole body. So I've seen myself having just a hand on the skull, because obviously horses, you can't have the skull and the sacrum at the same time. But I've seen myself just having hand on the skull, and the horse is repositioning his whole body, just slightly moving because you're working on the nervous system. The other one I used is joint mobilization. So basically it's moving the joints and getting more movement when there is restriction of movement. So that's only 3 big ones. I've got visceral techniques. So I kind of move the organs. As the organ have a movement they do by themselves all day long. Sometimes that movement is a bit less than it should be. So I just, get to that movement to get better. So yeah, really hard to explain because it's really precise things.
No, thank you. Honestly, to me, that was a good explanation, because again, you know, it makes sense to me, as you say. I am doing fibromyalgia, and I know the Maya, but it relates to muscles. I think the algia is the pain element of the language, and then fibro is to do with the fibrous tissues. So it makes sense to me when you said about myo being muscles and myofascial fascia as well. So that does make sense. And for anybody that has probably seen an osteopath for themselves, I've seen an osteopath, I've seen chiro, I've seen a craniosacral therapist, and certainly, again, I can relate to the craniosacral therapy in terms of if you put it down to a very basic, really like know nothing about it level, it just feels like someone has 2 fingers at the back of my head, you know, just in like a little indent on my skull, you know, and I'm just sitting there, you know, and I might feel something pop, or I might feel some energy move, or I might suddenly, you know, just jolt, or just feel a release of some sort. I might just feel really relaxed or very peaceful. So I find with craniosacral, it's a very gentle therapy but very powerful therapy, and as a receiver, as somebody that's actually having it, certainly for me, as I say, it's so gentle. Sometimes I can't always feel the effects straight away, but actually it's at the end of the session I'm like, I do feel very, very relaxed. So I know that it's done its job. I know what it's been doing. And I suppose that's the lovely thing about those techniques, as you say, is you're working in different ways. You're using what you've been presented with as the symptoms, and as you say, they're how they're walking, their posture, where you can see them compensating, to actually go, right, this is going to be the best technique for me to use based on what I'm seeing, what I'm feeling with their body. And also I should think how the animal's responding as well, because I know you said about them moving. I mean, I've seen that when I did a particular practical technique that I used with a pet that was recovering from cruciate surgery, knee surgery, and obviously we do it hands off, because obviously I'm not going to touch a wound, that's for sure. And actually, as I was kind of working with this technique and obviously moving the energy, the dog was actually turning around looking, and they weren't they weren't distressed, they weren't saying this is a problem for me or anything like that. It was just their way of saying, I can feel the energy moving, and I know that if it was uncomfortable for them or wasn't the right thing for them, they would have got up and they would have moved off. So thank you for explaining that, and hopefully, as I say, maybe me adding that a little bit to it, in terms of anyone here that's gone through craniosacral therapy or osteopathy will hopefully understand it on that level. So thank you for that.
And working with the animal, looking at how they're reacting to me is actually a big part of my job, because I believe an animal that is really stressed, not happy with what I'm doing, it's not gonna release, shift, and heal as well as another animal. So I'm literally having a chat with the animal, always, most of the time, looking at their head to know if they're happy with what I'm doing. And it's all about a discussion. Sometimes horses, especially, are really expressive. Sometimes they're like, I really can't deal with that. In that case, I'm gonna move somewhere else, do something else, start release somewhere else, and I will come back to that area. So sometimes I can see there, oh, I don't really like that. I'm like, I know, but it needs to be done. Let's do it. And then they start to yawn and blink, and you can see there's a lot of release happening in them. So it's all about having a big chat.
Lovely. I love that. And I was just going to say to you, actually, when you were saying about having the chat, do you tell animals what you're doing before you go to do it? Do you sort of say to them, right, I'm just going to start working with your hindquarters. I'm just curious, really.
No, I don't do it. I'm trying to think, because it could be something I do without realizing I'm doing it. I do chat with them, and I think my intention is there. So I think a lot of them, I've never met them, and they're quite chill and relaxed. So I feel they kind of understand there is something good that's going to be happening.
Yeah. And I should think after the first consultation as well, when they've then experienced that treatment, the next time they see you, they're going to be super excited, or like, oh yes,
Yes.
she's the nice lady that heals
Yes.
me, or so they're like, you can come in, it's fine, and that's what I love, because you do
Yeah.
see that. Yeah. And just for our listeners, you also said about, when you see the signs of release. So when you're working, what would you say for you are the main signs of release that animals will show you that's happening?
So once again, there is a big conversation at the moment about horses yawning. A lot of people are saying this is not a release, it's them releasing stress, so they're not feeling really well. So I think there is different types of yawning. I do think sometimes, and I see it with dog as well, sometimes they look stressed and they're doing a yawn. I can tell it's because they're stressed. But when a horse is starting to close its eye, his head is going down, starting to chew very gently, starting to yawn. To me, those are signs that there is a lot of release happening. And with horses, they're quite funny. Sometimes they just stare blank, you don't know what they're looking at, and you can see something is going on in the brain. So usually what I do at that time, I take my hands off and I'm like, go for it, do your process. And the owners, they know their horses, so they can see it as well. So you give them a minute, and then you see something happen and they start moving again. And we're like, okay, you've done it. All good. And with dogs, dogs have more the ability to just fall asleep. So I would say sometimes you don't get that much response from them because they're happy, relaxed, they just fall asleep and they start dreaming. And you're like, okay, I'm just gonna carry on with my job. But I guess them falling asleep is a big sign that they're quite content.
Yeah, no, that makes sense. Absolutely. I'd never, I suppose, seen those differences, but yes, I can see what you're saying there. And I know when I'm working that often we will see the yawns, as you say, will big sighs, I find when they do that kind of really like I'm like, oh, okay, they're letting go. They're really letting go now. And for me, I often see them. I know you're saying about it looks like they're staring into nothing. I sort of see it as like they could just got like glazed eyes.
Yeah.
Like even if you did that, they just wouldn't even blink. They wouldn't move, nothing. So I often see that, and I know from hypnotherapy actually that when we are relaxed, when we're very deeply relaxed, one of the signs is actually swallowing more. And I've noticed that actually pets and animals will do exactly the same thing.
Yeah.
So it's really interesting to sort of see that side of it. But yeah, I love it when you, as you say, you get those particular signs from them, and it's just, you know, it just not encourages you because you know what you're doing and I know what I'm doing, but it's lovely to see those responses because you know what you're doing is having the effect that you would like, and actually they are letting go.
Yeah, and there is, as I say, the behavioral components, because some of them they can't always let it go because there might have been some trauma, physical trauma, but that they also keep in their head. And some of them, sometimes I can see them about to release, but they can't. So it's good to have that feedback, um, to know if they have done the release or not. I can feel it obviously in their body as well. But I like it's a conversation.
And you can often see it when they're walking as well, can't you? Because I know when I've done the relaxed dog classes where we do the hypnosis, the canine hypnotherapy, and I will often say to people, right, I want you to just observe how your dog is before the session and after the session. Because what I'll often find is because they've released, you know, muscle tension and they've been really relaxed, often their movements are much more fluid. They're less tense as they're walking, less staccato. So I'm sure you see probably a very similar thing, that obviously everything's a bit more fluid because everything's flowing better, isn't it? The energy's flowing better. So yeah, thank you for sharing all of that. As I say, I just think it's lovely for, again, you know, there might be people that go, oh yeah, my horse does that, I've seen them do that with so and so, you know, so it's really nice for them to be able to hear that as well. And one thing I wanted to go back to was to do with the pain and the behaviour, because you said obviously, so what would you like to share with our listeners about the link really between pain and behaviours? Because obviously we do know that, you know, when pets are in pain, same as probably when we're in pain, our behaviour can change. So is there anything that you'd like to share with people about that at all?
Well, as you said, if my stomach is painful, I might be grumpy. If my muscles are sore, I might not want anyone to touch me, so I might become nervous of touch. So it's quite simple how our behavior, how our pain can affect our behavior. And what I want to say, dogs and horses are not naughty. They're not mean. Usually, if there is what we call bad behavior happening, there is a reason for it. It might be a psychological trauma that happened beforehand. In that case, you might need to work with a behaviorist or other professional. But quite a lot of time it is coming from pain. So I think what I want to share is get your animal checked by an osteopath, a physio, a vet. It doesn't matter that much. Get them checked if there is some kind of bad behavior, because there is once again, they are not mean, they are not being naughty. There is some things that's going on in their body.
And I would think, certainly from how I work with people, I will say to them if it's very sudden as well. Because it's like, yeah, and actually I had a case where I was working with a dog. I was doing a spiral technique that we use, and I'd worked with this doggy before plenty of times. He knew me very well, and actually I was working under his throat and he growled. And I remember saying to the owner, "Oh, he's growled." And she was like, "No, that was just him, saying he's enjoying it." Kind of, But when you kind of go, "No, that felt like a growl to me." And I actually said to him in my mind, I actually did say to him, "Darling, if that was a growl, I'm gonna just do it above here, just at the top of your neck. If that was a growl, darling, can you do it again for me a little bit longer and I will completely stop." So I wasn't actually even touching his body, but obviously something in him was saying, "I don't want you around that area." And when I tried to do it on the back of his neck, he did a longer growl. So he did exactly what I asked. And I said, "Thank you, that's it, I'm stopping." And I actually said to the owner, has he done anything recently that relates to that kind of area? And she actually said to me, "Well, we went for a walk over earlier and he clotheslined his lead." And for those that don't know, that's basically where they run into the lead, at a bit of a pace. And so obviously, there's a potential for that, isn't there? The whiplash or that side of it. And I actually said to her, "I know you said you're going to the vets this afternoon. Could you just ask them to check that area? Because he normally would let me work all over him. He won't let me work here and he won't let me work there." And absolutely, he's not being naughty. He's not being spiteful. To me, with what I do, we always say everything they do is to feel safe. He didn't want me anywhere near this area because it was feeling vulnerable. The same as, like if you've broken your elbow and somebody says to you, "Right, we're going to go to London and we need to hop on the tube, the underground," you're going to constantly be like, "Keep people away from me, aren't we?"
Yes.
And I share it in that way, really, is that they're no different. They're going to want to, as you say, keep people away.
And one more thing I would like to share is you're using an example which is quite obvious, dogs that growl, but signs, because they can't speak, signs of pain can be so subtle in dogs and horses. So it can be a dog that doesn't jump nowhere as much on the sofa. He still does it, but not as often. A dog that looks a little bit more tired on its walk, a dog that doesn't feel like playing today, a dog that flinch a little bit when you touch him. It can be tiny, tiny changes that you might not really pay attention to, but those changes are the beginning of in discomfort. And if you don't listen or see those changes, then that might escalate into more stronger behavior.
Yeah, no, thank you for that. Because I think it is important, as you say, it's not always in your face, something you can directly see. As you say, with my example, yes, it is. Because the thing is they can hurt themselves, as you say, jumping off from the settee, turning round. I mean, we do it, don't we? Where, we'll do certain things and you'll be like, "Oh, I've pulled a muscle or I've done something," and you're like, "That's weird, how's that happened?" And we can't always explain it, but so it can just be even just simple things where they've perhaps been playing in the garden, haven't they, and they've been playing a bit rough and one of them's gone over on their side and something's twisted in the wrong way, or maybe they've run a bit too fast and they've hit the fence, or all these kind of things that they do in their mad moments. And you might kind of go, "Oh yeah, they're all right, they've dusted themselves off and they're running around, it's fine." But actually they might have just pulled a muscle, or there might just be this twinge that only happens when they've then calmed down and settled down for the night, and then they get up and it's like, "Oh, I felt that twinge." So yeah, thank you for sharing that, because I think it is important. And again, like elderly pets, isn't it, obviously as they're getting older and obviously things are changing, there's obviously it's watching for those signs as well, isn't it? I mean, I know it can happen in any age, but again, obviously with elderly, isn't it, I would think anyway, it's a case of paying attention. I mean, I know when I had Panda, he was a 20-year-old foster cat, and I only had him for 8 weeks of his life. But with him, it was the subtlest of movements where he'd got on my lap and went to put his front paws on my chest. And as he lifted himself up, there was just this little up, and you could just see that just tiny, and I mentioned obviously to to the fosterers, if you like, to and to the vets, you know, I think there might be something going on with him, you know, and I think that's when he was given obviously the Metacam or whatever it was at the time, and he was already on U-Move supplements anyway, but you know, that was really subtle and could have been very easy to miss. So that's the thing, it's not always in your face, really easy to see. So thank you for sharing that. The other thing I was going to ask you as well, and I think I know what you're going to probably say to this, but is it possible with some animals that you see that their owners' emotional state or state of well-being or what's going on with them can actually affect pets in terms of things like they might be holding, you know, tension because of stress going on in the household or anxiety going on? You know, is there anything that you'd like to share with regards to that?
I'm pretty sure it does from my experience, from what I've seen, but I don't have any, I haven't studied it. I don't have the knowledge for that. So I don't bring it up during my session. I just see it and I'm like, okay, so there might be a link there. But yeah, I did wish to do more work on that, to have a better understanding of the relationship. There have been studies done recently that showed, I think it was something with human sweat, when they were stressed, the dog was reacting a different way. So there have been studies proving that the state of the owner is going to affect their dog. Now, how to work with that, how to work on the owner as well as their dog, how to word to the owner, I think how you're feeling might actually be detrimental to your dog. It's something I'm not going there right now, but I would like to learn more about and to be able to help owner a bit more with that as well, because yeah, so there's something.
No, thank you for that. I just wanted to ask, just, I mean, I work a lot with that myself in terms of, you know, pets reflecting their owners and mirroring their owners or sending them messages of things that they need to heal. And the Heart Math Institute has certainly done a lot of research around the connection, because the biggest ways that animals sense the world is through electromagnetic fields. Our heart is one of the strongest electromagnetic fields, obviously within the body. And the Heart Math Institute have definitely done some research obviously on that, and I just thought, well, yes, I can certainly see, for instance, like if I get stressed, I know Puss gets quite, you know, will get stressed as well. Her eating habit will change, you know, if I'm not being as playful, she will not be as playful. So there's definitely those mirrors. And I thought, well, actually, you know, in that element, obviously, if I'm stressed, then physically that's going to potentially affect her, that if she's stressed, she's going to tense up. So I'm always kind of trying to watch that with myself as best as is possible. So just one further question to ask really, which is, if somebody was looking to work with the services of an animal osteopath, where could they find information? Is there a register? Is there a directory where they can kind of go and, you know, see who's registered with that professional body, if you like, or that directory?
So there is a couple of bodies. So there is association. So I'm part of the IAAT, which is Association of Animal Therapists. But there is others. And there is also a register which is called RAMP, so RAMP. So they check people's diploma, that checks that we're doing our continuous development course. So the checks that we're still learning. So they're quite a good one to look at, because they're looking for a gold standard for their therapists. So they've got a website and they've got a list of therapists per area, I believe.
Okay, Laura, and that was RAMP, is that right?
Yes.
Okay,
Yes.
lovely. And for our listeners, obviously, I will get those details from Sophie afterwards, and I will share those in the description or somewhere within the podcast where you can easily access it as well, so you can have a look at that yourselves. So last but not least, how would people contact you if they wanted to actually take advantage of your services?
So you can find me on social media, A S Animal Osteopathy. I actually try to do quite a lot of informative posts, so I think it's good to follow me anyway. my website is www.asanimal all together .com, and you've got my email address, which is elaine.sophie@hotmail.fr for France. So I will give that to you. You can put that in the podcast. And my number is 0758 226 0603.
Lovely. Thank you very much. So thank you for sharing everything that you have today. I hope for our listeners, this has been an informative interview for you. You know, one of my straplines that I've had for a very long time is awareness is empowerment, you know, because actually how can I how can I make choices if I don't even know what choices are available to me? How can I make change, you know, within myself if I don't know what's out there for me to, you know, and that there's even an issue. So this is what I want to bring, I think, to pet owners as well, really, is actually, you know, when we're aware of different options, then we can actually invite that conversation with our vets. We can talk to them, we can discuss about, you know, acupuncture, osteopathy, chiropractor, you know, whoever it is, you know, that we might be thinking of, physiotherapist, to have that conversation and actually move forwards in a way that works for both parties. So thank you for everything that you've shared. Thank you for your time, your energy. I hope everyone here has enjoyed the podcast, and, you know, please look forward to the next session that we'll be doing in this bonus series. Take care.
Thank you.